now. Eoghan, good morning.
Good morning, Pat.
Now, the green list, what green list? There's nothing on it.
Green list with nothing on it, but today's an important day, Pat. We learn whether Ireland is signing up for the European Union traffic light system in full, or they're just saying that they're signing up, because they have signalled quite a bit ago when the green list was falling apart. It wasn't working very well to start with, that they were going to align with Europe. The big agreement is today. It was agreed more or less over the weekend on the traffic light system, the rates for the traffic light system and how it will be put together. It is not clear, though, whether Ireland is going to just pick a little bit of it or to sign up for the full protocol.
A little bit of it. I mean, the green bit of it, this seems to be, if you travel in from one of those countries that are green, you don't isolate. If you travel in from a country that's orange, what happens?
We don't know. The European protocol is that green, the orange is the colour to watch here, very clear. Green under 25, there are no European countries on that. The only country in Europe that would make it is not an EU member, it's Serbia. The next is the orange, or amber as other countries are saying. That's where the big question will be. It does appear from what Eamon Ryan said at the Oireachtas committee last Wednesday and what Stephen Donnelly said on Sunday, that they think orange equates with red, but the rest of Europe thinks orange equates with green. If you're flying in from those orange countries, you will not have to self-isolate or will not be subject to restrictions in other European countries. We remain to see whether Ireland decides orange has to self-isolate. This is really important because there are no countries, as I say, Serbia, we don't have flights there, but there are no countries that would make the green list at the moment, and there are about 8 that would sit in that position between green and red. And they include really important places like Germany.
Okay, but Eoghan, it's a bit of a joke, because this business of isolation, you promise to isolate, you give them a phone number, off you go. You might be called, you might not. It's a mobile phone, so who knows where you are. There are places where in Singapore, I think they had to wear, was it an anklet or something like that to keep track of them? It's one of those countries anyway. I have a note here from Bermuda because I'm familiar with it. This goes, my brother lives there. His sister-in-law from the US is staying with him for a few weeks. To date, she's had 4 tests and is due her 5th on day 14. All test results are back within a few hours. They've managed to keep the island COVID-free. In Ireland, our testing of people arriving in from abroad is non-existent. They don't even have to quarantine. So, I mean, we're not really serious. Whether we've green, red or orange, I mean, it's all tokenism because we do nothing.
Beautiful Bermuda, and I know, I agree, I've been there, will lead us into the really important end of this debate. People are citing, going on radio and television programmes such as yours, saying this country locked down and it's clear, this country didn't. We've seen no similarity between the countries that locked down hard and the countries that remained open and their actual case rate. You could pick a country that locked down really, really hard and see a low rate. And a good example would be Uruguay and Argentina, both locked down really, really hard. Uruguay is an example for the rest of the world. Its 14-day case rate is around 8. Argentina's is nearly 800. Czechia, one of the countries that locked down hardest in Europe, is our worst. It's our basket case. 483 cases over the last fortnight. That's nearly 3 times what we have. Country like Portugal that stayed open all the way, no restrictions, no quarantine, below Ireland. There are examples of countries that have fared very, very well. But when you actually stack it up against their travel policy, and let's strip everything else out, you can see patterns where people had well-organised health systems and responded well. That seems to be more of an indicator. But it's the European aviation industry, the European Centre of Disease Control, the World Health Organization have all said, keep borders open, keep travel moving. And they would not be saying that. And they've been tracking this because they just didn't say this in March and close the file. They've been tracking whether international travel and keeping international travel moving actually exacerbates situations. Nobody can say that international travel will not bring in cases, But the number of cases that it brings in, and to give an example within Ireland, 20 infections came through the airport out of 140,000 people in the first 20 days in September. That is not creating a problem.
We've unless you test and trace really thoroughly, you don't know whether or not other people have been in and are spreading the virus around. But if they're asymptomatic and are not detected, and don't forget, you've got to work your way back. You can't just do, who did you talk to yesterday? You've got to work your way back maybe 10 days for contact tracing. We're simply not doing that.
We know in that... Okay, how do we know? We know in that case because they're the ones that showed up in our testing system, and as you say, no testing in airports. Countries have put resources into testing at airports. Italy put it in for arrivals from 4 specific countries, and Germany's put resources into testing at airports. They are coming up with similar sort of figures, very, very small numbers. I know if you want Pisa Airport, to give an example, the first few days when I was sort of having a look at the data here, they had a grand total of 30 cases from 40,000 arrivals. They're really in the test and trace for international aviation. I know the aviation community wants testing. Everybody in tourism and hospitality wants testing on a grand scale because they see this as the solution. What the people who are wise in aviation, and you had, I think, Alan Joyce on your own programme, they're looking at the second half of the equation as being more realistic, which is the tracing. There is no industry that is has more data on your movements, on your passport, on your date of birth than aviation. So when something pops up, and remember we've had the grand total of 2 infections on flights since the start of this, both of them early in March. They are the ones who can provide the data as to who is sitting where on an aircraft. They see more hope in that future because the notion of wide-scale testing isn't really. It's not. First of all, it doesn't have the confidence of the medical community, and then the fact that it seems to be a moment in time, and the fact that it's also can turn out to be expensive, and there are arguments between the testing systems. That debate is all over the place. The debate that is quite clear is that tracing very easily done in the aviation sector. And that's where people like Alan Joyce, people like Willie Walsh would say that could be more a realistic option to keep our get our borders open.
It's got to be both, because if someone is developing the symptoms of COVID-19 but has nothing, no symptoms, not sneezing, then 5 days later, somewhere down in the west of Ireland, they develop the symptoms, and you go back and you find out the 3 people who were sitting closest to them on the aircraft and so on. It would be much better to know whether someone had the virus in their nose, in their throat, even if it was only, beginning to bubble up. It would be interesting to know that. When we have the 5-minute test that costs $5, I mean, that's the holy grail, everything will change.
The reality is it will have to be both, but the pattern of this is sick people don't fly. Airlines have...
You're not sick. You can have the virus up your nose, be not sick at all, and be giving it to other people, be shedding virus. That's why it's so complicated. You can be asymptomatic with it beginning to burgeon, and you don't show the symptoms for 5 days. That's the issue. So I think we probably need both.
Yeah, we need both, and airlines do. Airlines do safety, Pat. That's what they do. They got the number of crashes worldwide down to 1 or 2. I spoke to you in another station from Mexico in the H1 outbreak when all the flights were being cancelled. Airlines flew through Ebola. They flew through SARS. They're not putting passengers at risk. They're very, very good at what they do on the safety side, and they are not going to be allowing people willy-nilly on to spread infection on board aircraft or on board the aircraft or boarding. And it's not a question of one or the other. I'm just saying that the whole debate on testing has concentrated on the fact that what Dublin Airport would require to test every passenger is the entire testing capacity in Ireland. No country, we've criticisms of our own system, but you could replicate that debate by 27 all through Europe. No country is going to fling their testing resources at international travel.
We have to leave it there. Eoghan Corry.
Always a pleasure, Pat.
Travel Magazine. Thank you very much for joining us. Now, thanks all.